You can start the recording. I see that. And this meeting of the Macomb County Community Mental Health Full Board. And I'll begin by reading the mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. Next item would be the adoption of the agenda, and the most recent agenda does show that item 8A has been removed from discussion. So we will not be discussing the community or the mental health authority this evening.
Move to approve.
Support Schmidt.
A motion by Bush, supported by Schmidt. Any discussion or comments on the agenda? All in favor, vote by signify by saying aye.
Aye.
Any opposed? The agenda is adopted. Next is hearing of the public. This is the opportunity for the public to bring any matters before the board. You have 5 minutes to speak. Please identify your name and where you live, or your place of business if that's relevant to your discussion. Is there anyone from the public that would like to address this board? To do so, you'll need to unmute.
Hello.
Yes, I see. Who was that? I heard somebody talk.
Yeah, Andrew Gamicia.
Andrew, okay, you may speak, please.
I just wanted to say, I was wondering if the minutes would reflect what we talk about from the hearing of the public, because all it shows in the minutes is that I spoke, didn't talk anything about my complaint of harassment or my request for any member of this board to contact me about it.
Okay.
And we also got a adverse action email, or I'm sorry, overnight mailed us by FedEx the day after I spoke last time, in the middle of my son's plan. So I believe that being retaliated against for trying to speak up about this. Thank you.
All right. Is there anyone else that would like to address this board? Anyone else? You need to unmute if you want to be heard. Okay, hearing or seeing no one, we will move on then to item number 5, and that's approval of the minutes of the regular meeting of the full board that was held on August 26th of 2020.
So moved, Burke.
Motion by Burke,
Support Schmidt.
supported by Schmidt. Any discussion on the minutes? All in favor signify by saying aye.
Aye.
Those opposed? The minutes are approved. Next is item number 6, approval of the standing committee meeting minutes of the program and budget committee meeting that was held on September 9 of 2020.
Move to approve, Kraft.
Motion by
Support
Kraft,
Fantuzzi.
support by Fantuzzi. Any questions or comments on those minutes? All in favor signify by saying aye.
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 Opposed? Motion carries. The minutes are approved. Next is item number 7, and that's to request to approve. And item A, B, C, D, E, F, and G were all on the program and budget meeting of 2 weeks ago, and those were discussed there.
So moved, Burke.
Jennifer,
Madam Chairman, can I ask to not vote on 7A, please?
yes, we'll carry forward your action on 7A.
Thank you.
Yes.
I'm sorry for interrupting.
That's okay. So there was a motion by Burke to approve items 7A through G. Is that correct?
Yes, Madam Chair.
Okay,
Support from Kraft.
support by Kraft. Any
Second,
discussion?
Kalua.
Okay, any discussion or questions on any of those items? Hearing none, all in favor signify by saying aye.
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 Any opposed? Hearing none, the motion carries. Next, we have a number of items that are new that are on this agenda that were not discussed at program and budget or any other committee meeting. And the first one is item H, premium pay extension from October 1 through December 31 of 2020. Dave, who would you like to lead that discussion? Explain it first?
Yeah, I'll kick it off. And Richard, feel free to add or correct.
Why don't we, you know what, before we do that, let's get a motion, if we could, please.
Move to approve Kraft.
Support.
O'Connell.
Motion by Kraft, support by O'Connell. All right, go ahead, Dave. I'm sorry about that.
So the premium pay extension through the state of Michigan is set to stop on the end of this month, on September 30th. And talking to finance, we are in a position now to continue that through the end of December, so a 90-day extension. There's also a lot of administrative work that goes into making these the rate changes in our system. And we do believe that the state, well, actually, we were going to go ahead and do this. And then I was in a meeting with the department, and they have some additional, they have some found money. And when they asked the regions for feedback and input, the direct care wage premium pay was the number one issue or idea for use of those funds. So it's very possible that the state will come out probably sometime shortly after October 1st with an extension. But in either way, we're in a good position, and we do recommend for this provider stability in our county that we do approve this. And because of the timing involved, we weren't able to go through the full committee process.
Okay, thank you. Any questions or comments by board members? All right, hearing none. All in favor signify by saying aye.
Aye.
Any opposed? Okay, item H, premium pay extension has been approved. The next one is item I. This too is a new item. It's a 236 transfer request. Well, let's get a discussion or explanation of this before any motion, unless somebody wants to make a motion, but this is was put on, I believe, today.
Friday, I believe.
Oh, Friday. All right, then I'll take I'm sorry. Let's take a motion then for this. Does anyone want to make a motion? Hearing no motion.
I'll make a motion for discussion.
Okay.
I'll
I'll
support it
second
for discussion.
All right, thank you. A motion by Bush, support by Schmidt. And if we could have an explanation of this, please.
Again, I'll start, and Richard's on for the additional information, but this was new to me. A 236 transfer is the official process at the state level to transfer general funds between CMHSPs. So we were in a situation where we had a surplus, and we reached out statewide. The department back early mid-August had reached out to all of the CMHSPs asking who was looking at a shortfall and who was looking at a surplus and would they be interested. I wrapped back around to the folks at the state level, and I worked closely with Richard. So if we don't do this, these funds would be lapsed back to the department. If we do this, these funds would go to those other CMHs listed in the packet. Happy to answer any questions.
Could we have an explanation of how these were selected? Were these ones that requested it, or how did this list get put together?
Yeah, it was, I reached out to the department, like I said, David Waldo, and they had kept a list of the CMHs that were in a deficit situation. We reached out and clarified some of them that the state had said they were already receiving funds from other CMHs, or that they had some changes in their circumstances. So what you have is the list of the actual CMHs who are in a shortfall. And then we, in most of the case, Richard has more detail about the specific dollar amounts. In most of it, it's what they ask for. The largest one had actually asked for quite a bit more. And we were able to give based on what we had as on our books.
Madam Chair, can I ask a question?
Yes, please do.
Okay, so Dave, I'm sorry, help me understand. Can I say it in like layman's terms? So basically, other community mental health organizations in the state were in a deficit in certain areas
In general fund.
in their general fund. And this is like a program where they're able to reach out, and if we have a surplus, then we can help them with that.
Yeah,
Is
the state allows it every year. You can do these 236 transfers between the CMHSPs.
And is there any, like, is there a guarantee that if we were in a situation like that, that they could help us if they had the funds? So there's no guarantee.
There's goodwill, but no guarantee.
Okay, understood. Sorry, I just want to make sure I understood. Thank you.
Good
Madam Chair, it's Selena. I have a question. So what about option 3, which would be spending it? Some of the providers that we have, like CARE, CEO, Clubhouse, they were shut down for months on end. And yes, they did receive some funds. However, their rent continued, their utilities continued, their taxes continued. They're struggling. Financial, you know, there's donations have dried up. People don't have the money that they had to go and give them money or fundraisers or anything like that. What about spending money on our providers that took pay cuts from us, that hadn't gotten pay cuts in, you know, a raise in a very long time and have been very loyal to us?
I can speak to that question. So the tricky thing is general fund represents approximately 3% of our total budget. And anytime that we're giving money to providers, we have to allocate the fund source based on the services that we are receiving in exchange for those, for that money. And so while we can do enhanced payments to providers, and we do plan on doing some of that, only 3 to 4 cents of every dollar spent hits this particular funding source. So we would, and I kind of mentioned that in option 1, identifying the allowable expenditures where we can utilize GF funding. So in order to spend the $3.1 million that we're projecting as a surplus, we would have to actually spend around $77 million in total in order to make that happen. And that 77 million, of course, would not be possible.
So could we not give them dollars, but can we give them material? Can we upgrade a van? Could we buy computers? Could we do something like that for them?
And the answer is yes, but all of those still follow the same funding formula, that it hits Medicaid, Healthy Michigan, and general fund proportionally. And so we are planning, of the 3.1 million surplus, our plan was to, we are allowed to carry forward 5% of our contract, so 400,000. We were planning on holding back $1 million of the 2.7 million surplus that is left to try to spend between now and the end of the month. And we have already started some reach out to certain providers where we do know we can spend GF only, especially residential. And then the 1.7 that we are recommending is what's left of that. So we do plan on trying to spend as much of this surplus as we can locally.
So it's not 3.1, it's not 2.7, it's really going to end up being 1.7 that we're going to give away? I'm kind of confused.
Correct.
Okay.
Yep, so the request for action on page 86 of the packet is of the 3.1 million surplus, we're requesting approval to transfer 1.7, or actually 1,775,000 to 6 CMHs throughout the state that did put in a request for funding because they're experiencing a deficit.
So we heard this during the summer, that there was a possibility we would have excess money. Why is it now coming on September 23rd with a week left that we're trying to sort it all out? I'm kind of disappointed because for years we were in the red. For years we struggled. For years we sat here and listened to hardship cases and we were cutting services and everything from all over the place. And now all of a sudden in 6 days we have to spend a couple $1 million.
A couple $1 million that apparently we can't spend, which I'm failing to understand that as well.
Yeah, I'm confused on it as well.
This is Linda. I'm confused because I reached out to some people who suggested things that other counties have done. And I don't know if they were rejected out of hand or if the information was incorrect. But things like equipment that providers have or bonuses for either the provider for the hardship. What's the word when you work through a pandemic? Hard pay or whatever it is.
Hazard pay.
Can't think of the word.
Hazard pay.
Hazard pay.
Hazard pay. So that's my one concern, that there could have been, should have been places that it could have been spent. And I don't know. I mean, the 7%, I never heard this, that we'd have to spend 77,000. This is the first time hearing that, to spend we'd have to spend 77 million to do 1.7 million. The other thing is, of these 6 counties who are listed here, are these the only ones who are qualified to get our money, or these were recommended by somebody? Are these the only ones left, Dave? You named some that are no longer in whatever, or some needed more. Are these the only ones left, or was there some criteria used to pick these 6?
No, nobody was left off the list. Through the chair, again, a lot of these questions are going to our providers. We do have the provider stability plan, and throughout the pandemic, we have been working with our providers, not through GF necessarily, through their Medicaid dollars. We did expand the general fund benefit when the pandemic hit, so that nobody got adversely impacted by the slowdown with the Michigan Department of Health and Human Services going remote, and with our staff going remote and things like that. We've had the ability all along through the pandemic since mid-March or into April for providers to reach out to us for assistance. We've made that clear repeatedly to our providers. Ask us for help. We've gone back to them and said, get creative. Any expenses you had related to the changes related to the COVID-19 pandemic, we will consider. That door has been wide open. We reversed the 10% clinical rate reduction. We're working, you have in front of you now the hospital per diem increase. We've removed the prior authorization for community living supports. And then most recently, we went out to the residential providers and said, if you did have expenses, at any time during this fiscal year, anything additional that wasn't covered anywhere else, submit it to us. And that's what Richard is indicating. We've set the $1 million aside for, and we are getting responses in that area. There was no service reduction on our side. We didn't turn away people without insurance. It's a surplus right now, and we just need to discuss how to dispense it. If we don't use it this way with the 236, it's a lapse back to the department.
That's an observation that I'd like to make, Kathy, at least, that yes, it's true that if we give it to these counties, it does translate to services to people in some form. If we lapse it back to the state, we don't know what it translates to.
Right.
That's a difficult position to be in.
Okay.
Madam Chair,
Yeah.
Dave, if it lapses back to the state, does it all lapse back, or can we still keep part of it and only that 1.7 lapse back to the state?
Richard?
Or Richard?
So our contract under the general fund has a 5% limitation for what we can keep. So the 400,000 that we've already set aside to carry forward is the maximum amount. So everything else, the 2.7 million, or minus if we can spend that $1 million that we've set aside, all of that would lapse back to the state.
Madam Chair, can I ask a second round clarifying question?
Yeah, go ahead.
So basically, if we don't give it to these counties to help somebody, it's just going to go back to the state and we're not going to be able to help anybody. And I understand that that's kind of a theoretical question, Dave and Richard, but I mean, is that essentially what you're saying? Because of course, I mean, I feel like we're all on the same page that we'd rather use the money to help people in need of these services, but I feel like we'd rather help our own counties, people in need. But I mean, is that basically what it is if we don't do this, then it's going to just go back to the state and doesn't help anybody?
So this is my opinion, is that if we do not do the transfer, it will go back to the state, and the state will use it to fill their budget shortfall, and it will not be utilized in any way that's meaningful for behavioral health services.
Thank you.
I have a
Ryan?
question for the chair.
Yeah.
This is Ryan.
Yeah, just a minute. I have Phil and then Ryan.
Thanks, Madam Chair. Just real quick, it wasn't that long ago that we were seriously struggling, and as of this, like Selena said, as of this summer, this is the first time I'd heard of this. Is this something that we asked for when we were struggling? Did anybody offer this up when we were struggling? I think it's ironic that all of a sudden now that we have all this money that we can just pass it around, but nobody was around to help us. I don't know if this was before Dave and Richard or not, but I'm just curious, did anybody reach out to us when we were struggling to help our budget?
So I can't speak from the CFO's perspective, but I do know that you can as a PIHP and a CMH, you can struggle in different ways. And so if we're struggling related to Medicaid and Healthy Michigan, there is a prohibition against transferring Medicaid and Healthy Michigan between PIHPs and between CMHs. That is not true for general fund because that is state funding, and because the mental health code for the state of Michigan specifically allows for this transfer. That's what the 236 stands for. It's the section of the mental health code that allows this. It's only when there is a GF problem, surplus deficit, that the transfer can occur. And in general, many CMHs have experienced deficits in the general fund funding source for many years now because of the reductions in the general fund dollars that have happened when Healthy Michigan happened, when the state took the state facilities back in-house and they started funding that directly instead of through community mental health. So I would have to go back and do the research of if we were struggling in the GF fund source only, but I know for the Medicaid fund source, you're not allowed to do the same type of thing.
Okay. Thank you, Richard. Thank you, Madam Chair.
Okay. I see Ryan. I'm having trouble seeing the raised hands, but Ryan and then Linda Bush on the second round. Is there anyone else on the first round?
I had my question answered. Thank you, Kathy.
Okay.
I don't know what
Linda?
round we're on, but I have a couple questions too.
All right, Dana. Go ahead.
But I can go after Linda.
No, take Dana. I want to hear from Dana, please.
Okay, Dana, please.
So I'm just wondering, I'm definitely all for helping other people that need it. I think being a newer board member, there's still quite a lot I don't understand. I would definitely like to do another financial workshop because I don't understand how we'd have to spend 77 million to spend the 3 million. I don't know if Richard could touch on that really quick. And then my other question was, how did we let the providers know that this service was available to them? I'd like to hear a little bit about that.
So again, and I agree, I think a workshop to get into the nitty gritties would be important. But at a high level, when we do our cost allocation for our budget to the different fund sources, Medicaid, Healthy Michigan, and General Fund, there are certain costs that Medicaid and Healthy Michigan are not allowed to cover. For example, equipment in residential homes is considered part of room and board, and so that's something we can use General Fund on directly. Other than those very few exceptions, we're required to allocate cost to the funding sources proportional to the volume of services that are provided out of each fund source. And so because Medicaid and Healthy Michigan are so much larger, like 96, 97% of all the services we provide are out of Medicaid and Healthy Michigan, 96, 97% of the dollars we spend with providers must be allocated in that same way. And that's under the cost allocation rules, 2 CFR 200 that we have to follow. So definitely can get into a lot more detail, but at a high level, it's because of that proportional nature of our cost allocation to services.
To your question, Dana, about how is this communicated, there was frequent and ongoing communication with our providers. Christina, our Chief Network Officer, was having virtual provider meetings weekly, and they were done by the various types of provider groups. When anything special like this came out, there was memos from me. Christina has our providers' emails. Things got blasted out. There was a lot of communication between us and the providers.
Okay, thank you both. I appreciate it.
Yeah. Linda Bush, Nick, did you have something?
Yeah, just a real question. Just a quick question. David, your comment kind of maybe answers the other question that I heard. When we were in serious trouble, were there such meetings going on? If I remember correctly, at that time, it may have been that everybody was in serious trouble. So there wasn't a whole lot to move around. But were there similar conversations going on at that time?
That would predate me. I don't know.
Well, maybe somebody from the staff would know. If they do, I appreciate that information. Otherwise, we just don't have it. That's okay.
Interesting question, those that brought that up. I still have Linda Bush on the second round, or did we get to you?
Yes, just a question, and I don't know if this is hypothetical. The fact that nobody responded, does that seem like there's no need, or they didn't understand, or whatever? I guess you could just guess at that. And then my second question is that when we had a general fund deficit the last 2 or 3 years, there was a special fund that I never even ever knew that we had, a reserve fund that we spent. We depleted a reserve fund by millions in the last 3 or 4 years. And I don't recall anyone offering to help us avoid that. Do you know what fund I'm talking about, Richard?
unrestricted?
So under the contract, and depends on how many years back we go, because the contract has changed a little bit over the past few years, but there is something that is commonly referred to as GF carry forward, that you can take some of your unspent GF and put it in that GF carry forward, and then it can be available in a future year for spending. And that is the 400,000 that I'm recommending. If we have the surplus, we would replenish that fund. It's very small because it's only 5% of our contract. Back in the day, prior to Healthy Michigan and prior to the state facilities moving, that fund could have been much larger because our contract was much larger. So 5% of that contract would also be much larger. So it wouldn't surprise me if you were referring to that.
No, well, I could be. I mean, it was just, we used it last year. There was a fund that we took, I think, millions out of that I didn't even know we had because we never had access to it for anything. That was like a reserve fund, but it was general fund money. And we used it to patch our general fund red ink.
I would have to do some research to look into that.
You can easily pull up. Yes, it's easily found because it was on, it was a line item. Thanks, Richard.
I see.
Madam Chair?
Yeah, just a minute. I see Dave has his hand, literally has his hand raised. Good, because I can't see him on this other
I
participant
just wanted
list. So
to
go ahead,
respond
Dave.
to the second part of Linda's question. It's
Yeah.
not that we didn't have any providers respond. We did. We had a number of providers respond to each of the offers that we put forth. It just hasn't been a floodgates, opening the floodgates on that. Providers had other sources of support through the federal. Macomb County did some stuff for employers. But no, we've had a steady stream of providers take advantage of what we're offering. So they were getting the message clearly.
Okay, good. Thank you, Dave.
Yeah. Ryan, did you have a question?
Yeah, I'm wondering if I can recuse myself from this vote. I see a possible conflict of interest.
With what?
I represent one of the mental health authorities on the list, and in my private capacity, I'm their attorney.
Okay, I'm not sure if that's a.
I'm not sure it's a conflict. I'd rather just avoid even the appearance of one.
Okay, that would be something this board would have to vote on to recuse you. Which we'll get to in a minute, but thank you for bringing
thank
that
you.
up. Yep. I have a question. Speaking of conflicts, I'm curious if any of these organizations of the CMHSP, if they have Raymond as their financial CEO, and if so, is that considered? Could that be considered a conflict? I don't know how that works.
So I do have professional relationships with many of those on the list, either CFO, so they're on the list of 6 that are left. We have professional relationships as the CFO of Kent County, or as contract consultants to the CFO, which is true for Clinton, Eaton, and Ingham counties. And then I have professional relationships with almost all of the CMHs in the state of Michigan. So from that perspective, when we reached out, I did inform Dave that I do have professional relationships with everyone. And so wanted to make sure that we weren't excluding anybody from the reach out. And then I did not want to make the final recommendation for the dollar amount because I wanted both Dave and the board to be understanding that it's not my decision to do the 236 transfer. It is just my understanding that we are in a surplus. We are going to send this money back to the state if we don't do a 236 transfer. So I've disclosed, from my perspective, I've disclosed that to Dave, but I'm open to answering any questions that the board has about the relationship.
Okay,
If I could add to that, please.
yes.
When Richard informed me of that, that he had some relationship with the others, that's when I went directly to the state of Michigan and got the list of CMHSPs that were in the deficit with the general fund. So all of those agencies listed there are directly from what the state told us, and a combination of what Richard had initially, but it's all verified.
Okay, thank you.
Point of order, Madam Chair.
Yes, Nick.
Yeah, I mean, I think Richard handled his conflict properly, and he doesn't have a vote anyways. As to Ryan, I don't think we went through this before. There was a former board member who insisted somebody needed the permission of the board to abstain. That's his call. When we went through Robert's rules on our own, we concluded that his decision as to whether or not to abstain is his, and I understand his concern. I'm telling him to abstain or not to abstain, but I don't think he needs our permission.
Okay, we had just dealt with this last night in my other life, and we had to vote on it, and it wasn't one of our board rules. But I get that. I'm all for if someone wants to just recuse themselves, they may go ahead and do that. So I'll take that advice, Nick. All right, any other questions or comments? Linda, just a minute before that, Phil had said something. I think, Phil, did yours get resolved?
Yep, I'm good. Thank you, Madam Chair.
All right, Linda, you had another round 3?
Nope. Is my hand still up?
All right, well, all right, very good. All right, then seeing
Hi. Excuse me, Madam Chair.
Yes, Lori.
Yeah, I had my hand up, but I don't have one on my computer to raise. So
I did not
guess,
see it. Yeah, go ahead.
No, I don't have one on mine. I guess I'm just shocked. I think it's great that we can assist other CMHSPs, but I guess, this is only my second year on the board, and I'm in total shock that we've known this for so long and this much money. I guess it's a good thing, but I find it hard to believe that we actually have to give that much money away. We know we've been sitting on this, and I've listened to all the explanations, but I again think I need, as Megan had suggested, I think I need more on the finance of the understanding.
Yeah, after the struggles that we've had the last few years, this is kind of quite the opposite. It's hard to swallow. I agree. Anyone else?
I'd like to ask something real quick.
This is for the board members' discussion only.
Okay, sorry. Thought people from the public could speak.
Thank you. Anyone else?
I have a question.
Yes, Tony.
The other CMHs that will receive money, are they coming from other CMHs as well? Or is there what's the control that watches for that?
I'm
not.
Yeah, go ahead, Richard. Can you address that?
I'm going to try to restate the concern, Tony. So please tell me if I didn't understand. Is the concern that, other CMHs that would get this money are going to get money from somebody else as well and would somehow double dip in their request?
Correct. That's precisely what I'm asking for.
So because the 236 transfer is controlled by the state of Michigan, the way that this will work actually is that we will inform both the other CMH and the state of Michigan, the Michigan Department of Health and Human Service, of our intention to do the 236 transfer. that both parties agree to both give and receive the 236 transfer. And the Michigan Department of Health and Human Services is the one that actually does the movement between the two. And so the department would not allow, the department themselves verifies that CMHs don't double dip, so to speak, in their request from other CMHs, if that makes sense.
Thank you. That answers my question completely.
Madam Chair, I know I'm like round 4, but I just have one more quick one.
For you, yes.
Thank you. Okay, so I am an HR director in local government, and I know if I don't spend money in my budget, my city manager the next year is going to say, hey, you didn't need that money. If this happens and it's documented and we're giving this money away and we're helping, which again, I'm all about helping 1,000%. I'd rather go to people in need than back to the state. But is this a situation where next time when the state is divvying out the money, are they going to say, oh, well, Macomb County, they're rolling in the money. They don't need it. Could that happen, Richard or Dave?
So I'm going to answer that question in 2 different ways. The first one is from a historical perspective, the 236 transfer has happened every year, not with Macomb, but with other CMHs throughout the state. So this is not a new thing for the state. And my experience with the other CMHs that have done that is that in the following year, they have restored the GF allocation to the greater amount prior to the transfer. And so that's never been an issue historically. Moving forward, is there a possibility that at the statewide level, they would look at the GF allocation as a whole? That's always a possibility, but it's my understanding that that total pot of money is appropriated by the legislature. And so I don't believe I don't have a concern that they would try to take away from just Macomb CMH as a result of the 236 transfer.
Understood. Thank you.
Madam Chair, it's Selena. Currently, one of the CMHs that we would be giving money to, my health system is partnering with them for some initiatives. So I'm going to recuse myself from voting on this because it may look like I'm approving it to benefit myself.
Okay. Anyone else?
Kathy, I just have one final comment. I raised this issue at the August meeting, and it's really too late to spend the money, and I understand that. Can we put this on the...
Can you repeat? Can we put this on the what?
We lost Linda again.
That was like right at the climax of the question too.
Right. Linda?
Sorry, I think Dave cut me off. Just kidding. Can we put it on the October agenda?
Oh, Linda, type it out.
We got to follow it next year, all the time.
Oh, okay, yes. Don't let this come so late. Next year, start the discussion earlier? Is that what you're saying?
Yeah.
Sounded like, okay.
Through the chair, Kathy.
Yes, Dave.
Part of my report, but we do have new procedures going in effect for next fiscal year related to our general fund, and our new CCBHC program will actually allow us to see more people with who are uninsured. So we're changing our general fund benefit plan to more closely track the differences between general fund and our CCBHC grant. But yeah, we have steps in place starting October 1st so that we don't hit this spot next year.
All right, thank you. Seeing no additional questions, we'll call for the vote. And Ryan and Selena are both recusing themselves. All in favor, signify by saying aye.
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 Any opposed? Is there anyone opposed? All right, hearing none. Motion passes. Good discussion, everyone. I think we all learned something from this one. Next item. Get my agenda back here. Is the new item, which is the SUD program detail. Substance use program detail?
Yes. So this item was a request to bring forward to the board from the Oversight Policy Board for SUD. And this is the detail that we used to request approval for spending of the PA2 funds, which you'll see in the second to last column of 4.1 million at the Policy Oversight Board or Oversight Policy Board earlier this month. And so they specifically requested that this would come forward to the board so that you would see the detail of based on which they, again, approved the PA2 funding of $4,158,158, as well as the recommendation, which is built into our budget that we will be discussing next, for the Medicaid Healthy Michigan and the SAPT block grant in the dollar amounts identified at the bottom of this sheet.
All right. Is this just for us to receive and file, or does it need our approval as well?
I would either, my understanding is that as the, we would still need to, I guess, confirm the approval of the use of funds that are being recommended forward from the Oversight Policy Board, and whether we do that as a separate action now or as part of the action with the 21 budget. I don't know that that matters.
Okay, so this, you've already said
Kathy,
it.
I see Helen's on. I'm curious, I forget the relationship between their approval board and our board. When that divided, it's a new configuration, kind of.
Okay. So Richard, you're saying this because this is just an a detailed explanation of what's going to be included in the 21 budget. Is that correct?
Yes, this is a detail of what's in the 21 budget. The PA2 amount is much more clearly identifiable in this document, which is why the Oversight Policy Board requested that it would be available to the full board to review.
Thank you. All right, then let's take a motion just to receive and file this.
So moved, Burke.
Support Schmidt.
Supported by Schmidt. All in favor signify by saying aye.
Aye.
Opposed? All right, so we've received that. Then we'll move on then to the next item, which is the fiscal year 21 budget, which would include the details that we just received from SUD. And you want to, first let's get a motion to approve this.
Bush, move to approve.
Support Phillips.
Okay, thank you. And Dave, who, you want to start this, or Richard?
This came to the full board last time, and then there was Richard made some minor adjustments. This is what was submitted, Richard, correct me, to the county as part of the 3-year.
Correct. So we did have to make some adjustments because of some rounding, but yes, this is the same information that we brought last month.
Okay. Any questions? If people could, any questions from the board members?
Madam Chair, I have a quick question.
Yes, Phil.
Thank you. For Dave or Richard, so the executive's office was asking all the department heads to come up with a budget and to have 5% cuts to personnel and 5% cuts to operations. Does that fall on us as well? Is that a decision that you guys had to make, or are we sort of exempt from that?
The only request that we received for a 5% reduction was in the county match that is appropriated from the county's general fund, and we did build in that 5% reduction request into page 3 of the proposed budget. So the reduction shows there is 5 lines from the top, a reduction of almost $200,000, a little less than $200,000 that we built into this budget. Otherwise, we did not. We were not required and asked to take reductions in other areas of our budget.
Okay, I kind of thought that would be the case because we get our funding sources from so many other places. I just wanted to check. Thank you, Richard. Thank you, Madam Chair.
Anyone else?
Yeah, Madam Chair.
Yes, Nick.
I mean, it's a small amount of money, so I don't want to make a big deal out of it, but I'm kind of curious. The county's match is determined by law, so they don't actually save that money by our cutting it, do they? I mean, sooner or later, they have to give us 10% of the state portion in order for us to receive the state dollars.
So to your point, Nick, as we go through the year and we start to project what our actual 2021 expenditures will be, if 10% of that ends up being more than we are budgeting, then we would put a request into the county for the difference of that. And so we would be making an adjustment request potentially towards the end of the fiscal year.
Okay, and while I've got the floor, if I can again ask, I think I heard you say this is the same budget we adopted before with adjustments made based on state and county requests, and are there any major state requests that are changed from the budget we've already adopted?
So just to be clear, the budget was brought forward last month for information only to discuss the format, and if there was any information that you felt was needed. I did not get any feedback for additional information other than the request from the Oversight Policy Board for the detail of the TA2 funding. So this budget today has not been previously approved, but it matches, the numbers match within a few dollars of what was presented last month.
Thank you.
Anyone else? Any other questions from the board members? Okay, hearing none, I'll call for the vote. All in favor of approving the fiscal year 21 budget signify by saying aye.
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 Is there anyone opposed?
Aye. Thank you.
Very good, everybody. Any opposed? All right, motion carries. Next is item number 9, resolutions. I'm not aware of any resolutions. Which leads us to...
Yep. Madam Chair, did you say 8B? The board committee?
Oh, thank you very much.
Sorry.
Thank you. Yep. We have item 8B, which is an updated CMH board committee list. And the reason that's inserted in there is because one of the members asked to be removed from recipient rights due to scheduling conflicts. So that is the new board committee list for your information.
Kathy, I'd like to speak to this list.
Yes.
I think it also added Megan to the compliance committee, but under the CMH Board Association, I think as a PIHP, we have 5 voting members. And as I recall, when we voted a couple months ago, Lori Phillips was added as our 5th person. Is that right, Lori?
I believe I thought so because we did have 5.
There were 4 commissioners and the CEO. Is that?
There are 5. We, as a PIHP, we have 5 voting positions.
Okay. So
not 4. There's 5.
Under the CMH Board Association? Is that where that goes, the voting
Pardon
delegates
me?
there?
Yes, yes.
Voting delegates?
Yes,
All right.
yes.
So we need to add Lori Phillips there. And then Megan Burke,
Thank
um,
you.
I'm on there.
in the compliance committee, she's listed there. And then removal of Fantuzzi from recipient rights. All right, let's, in the past, we've approved this list, so I would appreciate a motion to approve this.
So moved, Burke.
Support Fantuzzi.
Okay. Any other comments or questions about the list? All in favor signify by saying aye.
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 Opposed? Motion carries. Thank you. Next is approval of the paying of the bills. We have the bill run.
Motion to approve O'Connell.
O'Connell
Support Schmidt.
and support by Schmidt. Any discussion on the payment of bills? Seeing none, all in favor signify by saying aye.
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 Opposed? The bills are authorized to be paid. All right, next we have our management report. Dave, I'll turn this over to you and you can introduce presenters.
Hello. Oh, there we go. Sorry, I stopped my screen share and everything flickered. Yeah, this evening we're going to hear from Helen Klinger, who's our director of our substance use services. So Helen, I stopped my screen share, so it's wide open for you.
Thank you. I'll go ahead and pull up my screen then. Second there. Is it showing?
Starting. There you go.
Yes.
Good. Okay, I kind of have to look aside so I can see the screen myself. So, okay. Well, thank you, everyone. I wanted to give some further updates and awareness of some of the services and responsibilities for the substance use division. I know it was not that long ago, I think just a couple months ago, where I was able to give some information on one of our major roles, which is determining the substance use needs. So during that time, you got an overview of our strategic plan that was submitted to the state, and it has since been accepted. So we were very happy with that because it went through without any changes or additions needed. So I thought the next piece that I would share tonight would be part of our role of ensuring a full continuum of care for contracted services. So within our services that we provide tonight, I thought I would focus on the treatment services that we provide for substance use services. As you may remember, all of our services for substance use are contracted out. That was one of the requirements in our contract with the state. Historically, when substance use was under the coordinating agencies, it was written into the law that we had to have the oversight role rather than a provider role, kind of working like a PHP from the very beginning. So we continue with that. So as far as our continuum of care, we have a whole variety of services that we can help people meet their needs depending on the severity of their substance use disorder and help move them along that continuum of care. So here it kind of shows it moving through the different levels of care. However, it's not necessarily a linear move. People can go from one type of service. It doesn't have to be in order or anything to that effect. So to give you a sense of who we work with, we have 16 contracted agencies specific for treatment services, providing services at over 31 different sites. Majority of those services, all the outpatient care is located within the county, but some of our other services like residential treatment is provided within the county, but also in other parts of the state as well, just due to availability of those providers. Most are really more in like Oakland County, so most aren't that far away, although we do have one as far as the UP. Just because sometimes we need services for adolescents and there's only a couple providers throughout the whole state who do that level of care at a residential treatment. So we wanted to make sure we always had choices there. All of our treatment providers are required to be licensed through LARA for the level of care that they're offering. All of the providers also have to be accredited by one of the 5 national accreditation bodies. for substance use disorder in the specific service that they're providing. That's a requirement as well. To actually provide the service, the staff within those agencies must also have a certification specific to substance use, and that is typically provided through McBAP, which is a credentialing body within Michigan that has standards in place and that does that credentialing and ongoing continuing education certification for staff. Services are required to be evidence-based treatment, and all of our providers have to be able to provide co-occurring substance use services, at least at the mild and moderate mental health level. So those, just as we go through, gives you just a little overview of the basic requirements of the programs that we contract with. For services, we have early intervention services. All of our service levels are based on the American Society of Addiction Medicine, ASAM criteria, and there's very specific descriptions and requirements that go along with that. Early intervention is sort of almost like a precursor to outpatient care. So this could be provided to people who are at risk of a substance use problem, who may be exhibiting signs and symptoms but don't currently meet a diagnostic category. So for us, we contract with this service specifically for our middle school and high school youth. So we have a contracted provider, Macomb Family Services, and they go into specific school districts throughout the community and provide on-site services to adolescents who have been identified either on their own or through the school as being potentially at risk, either through change in behaviors, some experimentation with use, maybe hanging with crowds known to be using substances and things of the like. So in that way, we provide some short-term care, provide a lot of education and support to hopefully avoid future substance use problems for these individuals. We also contract for outpatient care. We have 5 contracted agencies providing services at over 12 sites. So outpatient treatment is an ambulatory office-based service in our community, all within Macomb County in a clinic setting. Services include things like assessment, group counseling, individual therapy, didactic educational services, family counseling, and for those with a mental health need, they do have psychiatric care available to do evaluation and medication reviews. Not at the level like our CMH specialty services would be. They don't do injections and they don't have some of the other wraparound services, but for mild and moderate mental health issues, they're meeting those needs. Also at an ambulatory level, we have intensive outpatient services. So we have 2 contracted agencies at 4 different sites who, again, it's in an outpatient clinic setting with many of the services that you would normally find in an outpatient treatment program. But here at this level, this is as somebody's substance use issues are becoming a little more intense. This is more usually intended for people who, you know, they can't go more than a few days maybe without substance use. So they need a more intensive treatment regime for them. So our programs typically meet 3 or 4 days per week, about 3 hours per day. It's a minimum requirement of 9 hours of service to qualify as an intensive outpatient service. And again, with all the core services that we would see in an outpatient care, but here the focus is more on providing group and educational services during those 9 hours per week. We have medication-assisted treatment. I touched a little bit on this as we talked about our opiate health home project last time. But here, this is a service provided for people who have opioid use disorder. They receive counseling and pharmacological services from a licensed program that is also DEA approved and meeting all the state and federal requirements. It's a very regulated type program. To be a medicated assisted program in our panel, you have to be able to provide all 3 opioid medications, including methadone, Suboxone, and Vivitrol. As far as the counseling services, it would be very similar as you would find in a typical outpatient setting with assessment, group, and individual type services. We contract with 3 agencies, and the services are provided over 5 different sites for that service. Residential treatment is a service that we provide at a more intensive level. This is a service that is supervised by clinical and medical staff, depending on the nature of the program and the needs of the individual served. But it's a 24-hour program with monitoring. Here, individuals have a very regimented type service day where they are very active and busy attending groups and specialty group services, individual counseling, educational counseling. They also focus on self-help type services as well as some healthy living activities. Services vary in intensity based on our ASAM criteria and the client's needs. And we do have some specialized programming that we contract for, one specific for pregnant women and women with young children, where the children can come with the mother to the program. That's provided through Sacred Heart Clearview. So that gives a safe environments and removes obstacles for some moms who otherwise wouldn't be able to go to residential care. We have 8 contracted providers with over 17 sites providing those services for us. Some of those sites that provide residential care also provide withdrawal management, also known as subacute detoxification. And that is a program that is, again, 24-hour care in a residential setting. Our services typically last 3 to 5 days, depending on the person's need and the substance that they're being withdrawn from. And this is the type of service that helps that person safely withdraw from the physical dependency of a substance before they transfer to the next level of care. For us, withdrawal management is never a standalone service. We always pair it up with another treatment service. Many individuals step down to the residential programming, but some may move on instead to the intensive outpatient or an outpatient level of care, depending on their need. Currently, we have 5 contracted agencies providing services at 11 sites. So just give you a view and some information on the array of services that we have. We do have a brochure that's available for anybody who is interested. And it kind of talks about what all the services are. And we also list out all the programs, the services they provide, and their contact phone information. So if that's something that you're ever interested in seeing, we do have that available. Is there any questions I can answer for anybody?
No, but great presentation.
Thank you.
Yes, thank you, Helen. Anyone, any other questions? Okay, thank you again. And we'll move on to the next one, Dave.
That's me. Thank you, Helen. You're a tough act to follow. Couple of things. We're working on, you guys approved the RFP for the learning management system, which will allow us to do more remote training. But you also approved the case to care management contract with the National Council. So Adam was point on that, and those trainings will be starting here shortly. Again, that's going to help our staff get more comfortable in dealing with the whole person, their physical health side, as well as the side we're more familiar with, the behavioral health, mental health issues. We are also working with Wayne and Oakland to combine our efforts. Governor Whitmer passed a directive requiring all healthcare workers get trained in implicit bias training. Was not required on our side, but we think it's a good idea. So we are working. I believe the trainer they're speaking with now is from the University of Michigan. So when we have more information, that'll come to the board. Our outreach.
Would it be possible for Dave? Would it be possible for the board to have implicit bias training?
Yeah, I fully intend to make that available to everybody. Yes.
Thanks. Thanks.
And with it being remote, it should be fairly convenient. The outreach efforts are going, they started really well and continue to do well. was so well, we had to divide and conquer this week. So I met with the Macomb Intermediate School District. Terry McCougar, who used to work with us, is now over there. And then we had Libby from our children's program, and pardon me, everybody else. But we have several programs with the school district. And again, we're trying to discuss how best to keep them going, given the current pandemic. The schools are trying to get the kids back, of course, and then there's the issues related to that. But it is a good partnership, and we will continue to build on that. The East Point Police Department and Officer Friedman they're requesting that we meet monthly on an ongoing basis, and we'll expand out from there to the other local police departments. And I did see on my schedule, we do have it booked for the Sheriff's Department as well. Primarily, again, it's the connection to the officers trained in the critical incident training, or CIT, who are being asked to respond to calls with a mental health component. So we'll continue to build on that relationship. I am working to complete, I thought I was done today, then I was reminded I have one more staff meeting. We have a large number of staff, and we broke those meetings down, but giving the updates to the staff, thanking them all for their work during the pandemic, the shift to the remote, the stressors that's causing on everybody. I'm on the statewide steering committee for Michigan's Stay Well line, and it's a free confidential counseling. You get mental health counseling, crisis counseling for anything related to the pandemic. So you've had changes in your life, you're stressed, or it's something worse than that. You don't have to give your name, and there's no cost. They can do 3 to 4, they can do brief therapy. So we're going to be working with them, sharing their information. It's a good resource for everybody, because I think we all know somebody or more than one person who is struggling right now. But it's a good referral source for us too. So when they've been talking to somebody, if they need more services, then they're able to provide. And if the person's willing to disclose where they live, they'll be connecting them to our services. Met today with the Macomb Community Action. They're doing a lot of outreach. We're looking at how to combine our efforts there as well. And Cindy is doing a lot of our items for like the business cards and stuff that the police department requested. We hope to have those out shortly as well. I touched on the changes we're putting in place for the general fund. We do recognize that it needs to be tracked closer. Part of that was timing with the changes to the CFO, the funding streams, things like that. But going forward, we'll be able to, report out to this body on an ongoing basis. Then Nick and I met with Crystal on the 16th to discuss the local jail diversion programs and what's going on there. There is the opportunity for some additional connections on our side. So we'll be following up there as well. Again, with the intent to, offer alternatives to people who might be, having issues with the legal system, and it's related to their mental health symptoms and stuff. So again, it's building those community connections and keeping them going. So thank you, Nick, for that.
Dave?
Yes.
Do you mind if I ask you a question really quick? I'm sorry. Do we have a go live date for the website? I don't know why I thought it had been before, but I know COVID has scrambled everything.
It has a bit. We have it working internally where we can get on and look at it.
Okay.
Not gone live yet. I will get you that date.
Okay, perfect. Just curious. Thank you.
That's about all I had for this evening. Thank you.
Is there any CFO update? Or did we already hear that through the other questions and answers?
Oh, yeah, I jumped ahead. I think it's just if there was questions for Richard from the program and budget presentation.
All right. Any questions? All right, hearing none. Then we'll go on to item 12. And that's other possible agenda items. And I will read the first one here, that a reminder, recipient rights advisory committee meeting on October 1 at 8:00 a.m. And we've received email about that. Just a reminder for you. Any other agenda items from, possible agenda items from board members? Okay. Hearing none, we will go on to the hearing of the public. Once again, this is your opportunity for the public to speak. You have 5 minutes to speak. And please identify yourself and your where you're from. Is there anyone from the public that would like to address this board?
Andrew Gamicia from Shelby Township.
Yes, Andrew.
In regards to the funds you're giving away, I was just wondering if any of those could have been used to avoid cutting and denying services to individuals within our county, and also to assist with a tech exchange, possibly to help people that don't have access to telemedicine devices. And also, I know that Macomb County is lacking part of the self-determination thing, agency with choice, if any of that money could have been spent for that. And also, one last thing, if you could have, if anyone checked into getting an extension for the returning of the money due to the pandemic, where it wouldn't have been such a hurried decision. Thank you.
All right. Thank you. Anyone else from the public like to address this board?
I would. This is Carolyn Gamicia, and I would like to make I would like to say that after so many years of us being in the red and having this these funds, over $2 million in funds that we're now allocating to other PHIPs, I too would like to know why this wasn't addressed earlier, and possible RFPs put out for supports of agencies like what Selena had mentioned. And I thank Selena for being so passionate about the comments that she made, because there's a lot of providers that have had to close their doors due to lack of support. There were individuals that had to seek other employment in other areas because they were not receiving premium pay in those months where the state had already allocated funds. So I'm wondering why this was done in the manner it was done. I'm also wondering as well, and I'm going to look into this to see those PHIPs that have been mentioned. There isn't one in the Tri-County area. We get a lot of people that move from county to county between Macomb, Wayne, and Oakland County. I don't know if they were in deficit, and I will look into that. But also within the supporting of these other PHIPs, I would like to know if they were fiscally sound, and why they were in the conditions they were in, even though you've already voted on it. I think those are things that should be asked. And then additionally, were any of those at any point at risk during the 268 conversations to be privatized because they were in non-compliance with their PHIP contracts? I think that that's an important thing to look at if because of what happened with Lakeshore Regional Entity and them having to be taken over by Beacon. I don't know if any of those PHIPs are within that entity, but that's something that people should have a realization of. And I do thank the people that had a discussion on this for doing so, because this is a very important issue. There have been cuts to families and individuals and families suffering in the last 6 months in Macomb County. So when I hear people say there's not been any cuts, there have been cuts. I also heard from 3 families in the past week that have contacted me and said that they've been told their individual plans of service have to be changed because respite's going to be cut because there's no money. So I'm wondering why case managers are saying these things to families when people are saying no cuts are happening, because they are happening, even if someone's on an extended plan during COVID. As my husband said, we've received 3 adverse actions on our son's extended plan because we've made comments at this meeting. They've come hand delivered to us. So I think people really need, on this board, need to have a realization that retaliation is happening and cuts are being made, and people under self-determination contracts are not being properly supported in Macomb County, because it could have been very easy for Macomb County to develop a contract for what they're supposed to have, which is an agency of choice. I heard Ms. Mozella, Christina Mozella, discuss that there are people knocking down your door to be provider agencies in the past. So all that would have taken would be to put forth a 30-day PHIP to request that. And it would have been very easy because one of your other agencies could have picked it up. So I'm trying to determine within this, if you're truly wanting to support people under self-determination, or if you're still trying to take it away like you did previously this year. So I'm glad that you had discussion today on this, because I do hope that the people on the board will learn these funding streams, because people are suffering in Macomb County, and you're going to find out about that very soon. Thank you very much for your time.
Thank you, Carolyn. Is there anyone else from the public that would like to address this board? Anyone else from the public? Hearing no other requests, we'll move on to item number 14, which is adjournment. Motion to adjourn is in order.
So moved, Schmidt.
Second,
Support,
Fantuzzi.
Philip.
Okay. All in favor of adjournment?
Aye.
Signify by saying
Aye.
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 All right. Opposed? This meeting is adjourned. Thank